13 signs of liver disease you can see. Did you know that subtle changes in your skin, your nails, and even the way your breath smells can quietly point to problems with your liver long before serious symptoms appear? Liver disease is far more widespread than most people imagine. In fact, it often develops silently, progressing for years before anyone realizes something is wrong. Working in the hospital, I see liver-related conditions every single day. And over time, I've learned that many of the warning signs are visible almost immediately, sometimes within seconds of walking into a patient's room. Changes in complexion, texture of the skin, nail appearance, or even subtle odors can all offer powerful clues about what's happening inside the liver. These signs are easy to miss if you don't know what you're looking for. That's why today, I want to walk you through the 13 most important warning signs of liver disease, the ones your body may already be showing you right now. By understanding these signals early, you can take action sooner, ask the right questions, and potentially prevent serious complications down the road. So before we begin, take a moment to really observe your body, because the signs may be closer than you think. Signs number 1. Muehrke's lines. Your fingernails are constantly growing through a complex process that requires a large amount of energy and nutrients. Because of this, changes in your overall health often show up in your nails earlier than you might expect, and liver disease is no exception. One important sign to watch for is a pattern known as Muehrke's lines. These appear as horizontal white bands running across the width of the nail. What makes these lines unique is that they are not part of the nail itself. Instead, they form in the tissue beneath the nail plate. You can actually test this at home. If you gently press on the nail, these white lines will briefly fade or disappear, then return when you release pressure. Because the lines are located under the nail rather than within it, they do not move forward as the nail grows. They remain fixed in the same position over time, which helps distinguish them from other nail changes. Muehrke's lines are often associated with low protein levels in the blood, particularly a protein called albumin, which is produced by the liver. When the liver struggles to make enough albumin, changes in blood flow and tissue composition beneath the nail can become visible. Signs number 2. Terry's nails. Another nail finding commonly linked to liver disease is known as Terry's nails. At first glance, the most striking feature is how unusually pale the nails appear. Under normal circumstances, nails have a healthy pink tone. This color comes from tiny blood vessels in the tissue underneath the nail plate. In liver disease, changes occur in this underlying tissue that make those small blood vessels harder to see. As a result, the nail takes on a pale, washed-out appearance, sometimes with only a narrow, darker band at the tip. If you're wondering whether your nails might fit this pattern, there's a simple detail to check. Look for the lunula, the small half-moon shape at the base of the nail. Seeing a clear lunula is normal and usually suggests the nail is healthy. In true Terry's nails, the lunula is often difficult or impossible to see because the nail bed appears uniformly pale. What these nail changes have in common? Both Muehrke's lines and Terry's nails are strongly linked to low albumin levels. Albumin is a critical protein made by the liver that helps maintain fluid balance and healthy circulation. When albumin levels drop, as they often do in liver disease, subtle but telling changes can appear in the nails. These signs don't confirm liver disease on their own, but they can serve as important visual clues that something deeper may be going on. And next, there's another physical sign you should be aware of, one that can appear in an entirely different part of the body. Signs number 3. Clubbing. There's a simple self-check you can do right now that can reveal important clues about your overall health. Place your fingernails together, tip to tip, like this. If you can see a small diamond-shaped gap between the bases of your nails, that's considered normal. This space indicates that the tissue beneath your nails has a healthy structure. However, if that gap is missing and the nails appear rounded, thickened, or bulbous, this finding is known as clubbing. Clubbing occurs when there is abnormal growth of connective tissue between the nail bed and the underlying finger bone. Over time, this extra tissue causes the fingertips to enlarge and the nails to curve downward more than usual. In some people, clubbing can be inherited and harmless. But when it appears later in life, It often raises concern for serious underlying conditions. When I see clubbing during a physical exam, my attention immediately turns to possible problems involving the lungs, the heart, or the liver. These organs are commonly associated with long-standing low oxygen levels or chronic disease processes that can trigger these nail changes. Clubbing by itself doesn't give a diagnosis, but it serves as a powerful visual signal that something deeper may need investigation. Signs number 4. Caput medusae. Portal hypertension doesn't only lead to fluid buildup in the abdomen, it also forces blood to search for alternative pathways back to the heart. When pressure inside the portal vein becomes dangerously high, blood can no longer flow through the liver as it normally should. As a result, the body begins rerouting blood through smaller veins that were never designed to carry such large volumes. A helpful way to picture this is to imagine a major highway completely blocked by traffic. Navigation apps then divert cars through narrow side streets and back alleys. Those streets quickly become overwhelmed. The same thing happens inside the body. One of the most visible places this rerouting occurs is around the belly button. Tiny veins in the abdominal wall begin to stretch, enlarge, and rise toward the surface of the skin. Over time, they become clearly visible as thick, twisting, swollen blood vessels radiating outward. This dramatic pattern is known as caput medusae, named after Medusa from Greek mythology, whose head was covered in writhing snakes. The resemblance is striking and unmistakable once you know what to look for. Caput medusae is a strong external sign of advanced portal hypertension. It tells us that the liver is no longer able to handle normal blood flow and that the circulatory system has been forced into dangerous detours. Signs number 5. Varices. The same rerouting process doesn't just happen on the surface of the body. It can also occur internally, where the consequences are far more serious. One of the most dangerous places this happens is in the esophagus. Here, enlarged veins called varices can develop as blood is diverted away from the liver. These esophageal varices are extremely fragile. Their thin walls are not built to withstand high pressure, making them prone to tearing or rupturing. When a varix ruptures, it can cause massive internal bleeding in a very short amount of time. What makes this even more dangerous is that people with liver disease often have impaired clotting ability. The liver plays a key role in producing clotting factors. When it fails, the body struggles to stop bleeding once it starts. This combination, fragile veins under high pressure and poor clot formation, makes variceal bleeding one of the most life-threatening complications of liver disease. Anyone who has worked in an emergency department can tell you how frightening these cases are. They often involve sudden collapse, severe blood loss, and a race against time to stabilize the patient. Varices may not be visible from the outside, but their presence signals a critical stage of liver dysfunction. Recognizing the warning signs early can make a life-saving difference. And next, there's another outward sign of liver disease, one that appears on the hands and can often be noticed long before internal bleeding ever occurs. Signs number 6. Palmar erythema. Palmar erythema refers to a noticeable redness that appears on specific parts of the palm. It most commonly affects the thenar and hypothenar eminences, which are the fleshy areas at the base of the thumb and the little finger. Interestingly, the center of the palm is usually spared, creating a distinctive pattern that helps differentiate this finding from other skin conditions. This type of redness can be associated with liver disease, but it's important to note that it isn't exclusive to liver problems. Palmar erythema can also be seen during pregnancy, which raises an important question. What do these two conditions have in common? The answer is elevated estrogen levels. Under normal circumstances, the liver plays a critical role in breaking down and clearing estrogen from the body. When liver function declines, this process becomes less efficient, allowing estrogen to accumulate in the bloodstream. High estrogen levels have several visible effects on the body. One of the most noticeable is vasodilation, meaning blood vessels widen and allow more blood to flow near the surface of the skin. In the palms, this increased blood flow creates the warm, reddish appearance characteristic of palmar erythema. Signs number 7. Spider nevi, spider angiomas. Elevated estrogen levels don't just affect the palms. They can also cause tiny blood vessels in the skin to expand in a very recognizable pattern known as spider nevi. These lesions get their name from their appearance. They look like a small red dot in the center with thin blood vessels radiating outward, resembling a spider's legs. Spider nevi are most commonly found on the face, neck, chest, and upper torso, areas where blood vessels are closer to the skin's surface. One fascinating feature of spider nevi is how they respond to pressure. If you gently press on the center of the lesion, the blood is temporarily pushed out, causing the spider-like pattern to fade or disappear. Once you release the pressure, the blood refills the vessels and the spider reappears. Having one or two spider nevi can be completely normal and may occur in healthy individuals. However, when 3 or more are present, it often suggests chronically elevated estrogen levels. If someone is not pregnant and develops multiple spider nevi, this raises concern for impaired liver function. In these cases, the liver may no longer be effectively clearing hormones from the body. Both palmar erythema and spider nevi serve as outward signals of internal imbalance. They don't confirm liver disease on their own, but together they can be important clues that warrant closer medical evaluation. And liver disease doesn't stop there. It can also lead to additional changes throughout the body that are just as important to recognize early. Signs number 8. Ascites. Fluid buildup in the abdomen. Now take a moment to look at this woman's abdomen. At first glance, many people assume she may be pregnant, but what you're actually seeing is a severely distended abdomen filled with fluid, a condition known as ascites. In advanced liver disease, the abdomen can stretch dramatically, sometimes holding more than 15 liters of fluid. This amount of fluid buildup is shocking to most people who see it for the first time. So where does all of this fluid come from? To understand that, we need to talk about the portal vein. When you eat, your small intestine absorbs nutrients into the bloodstream. All of the blood coming from the digestive tract is then routed through the liver via the portal vein. This process allows the liver to filter toxins and process nutrients before the blood circulates through the rest of the body. It's a critical protective system. As liver disease progresses, however, the liver becomes scarred and stiff due to fibrosis. That scarring begins to block blood flow through the liver. Think of it like squeezing a garden hose. The tighter the squeeze, the harder it is for water, or in this case blood, to pass through. This leads to increased pressure in the portal vein, a condition known as portal hypertension. Under this high pressure, fluid is forced out through the walls of blood vessels and leaks into the abdominal cavity. That leaking fluid is what causes ascites to develop and worsen over time. Ascites is not only uncomfortable, it can be physically debilitating. As the abdomen expands, it pushes upward on the diaphragm, making it difficult to breathe and even harder to move or sleep comfortably. In many cases, I perform a procedure called paracentesis to relieve this pressure. This involves inserting a needle into the abdominal cavity and draining the excess fluid. During my training, I performed paracentesis on patients whose abdomens were so distended that multiple large containers were filled with drained fluid. Seeing that much fluid removed really drives home how much strain the body was under. After the procedure, patients often experience immediate relief, less pressure, easier breathing, and improved comfort. But ascites itself is a sign of advanced disease, and it tells us that the liver is struggling to perform its essential functions. And next, there's another critical sign of liver disease, one that often shows up in a completely different part of the body, but is just as important to recognize early. Signs number 9. Muscle wasting. Muscle wasting is another important physical sign linked to chronic liver disease, but it isn't always obvious at first glance. In many cases, the loss of muscle mass develops gradually and can be easy to miss unless you know where to look. One of the most reliable places to check is the palm of the hand. The muscles here are small and lie close to the surface, making early changes more noticeable compared to larger muscle groups. Another key area I often examine is the temples on the sides of the head. When muscle wasting occurs, these areas may appear hollowed or sunken, giving the face a more gaunt appearance over time. So why does muscle wasting happen in liver disease? The liver plays a central role in processing nutrients, producing proteins, and storing energy for later use. When the liver becomes damaged, it can no longer perform these tasks efficiently. As a result, the body shifts into a survival mode and begins breaking down muscle tissue to use as an alternative energy source. This process not only weakens the body but also reduces strength, balance, and overall resilience. Over time, muscle wasting can significantly impact mobility and quality of life. Signs number 10. Dupuytren's contracture. Before moving on from the hand, there is one more important feature to look for. Notice the puckering or tightening of the skin in the palm shown here, along with fingers that appear curled inward. This condition is known as Dupuytren's contracture. It occurs when the connective tissue, called the fascia, within the palm gradually thickens and tightens. As this process continues, it pulls the fingers inward and prevents them from fully straightening. The fourth and fifth fingers, the ring and little fingers, are most commonly affected. Dupuytren's contracture can develop for several reasons. There is a strong genetic component, and it is especially common in people of Northern European descent. Because of this association, it has earned the nickname Viking disease. However, it is also seen more frequently in people with chronic liver disease, particularly those with long-standing liver damage. There's a simple way to check for this condition at home called the tabletop test. Place your hand flat on a table and try to press your palm completely down. If your palm cannot lie flat because one or more fingers remain bent, this may suggest the presence of a contracture. While this test doesn't confirm a diagnosis on its own, it's a useful screening tool that can signal when further evaluation is needed. Both muscle wasting and Dupuytren's contracture are subtle but meaningful clues. They remind us that liver disease doesn't only affect internal organs, it can quietly reshape the body in visible physical ways long before more severe symptoms appear. Signs number 11. Hepatic encephalopathy. This is a condition I encounter frequently in the hospital, and there's actually a very simple test you can try yourself at home. Hold your arms straight out in front of you, then extend your wrists and spread your fingers. For most healthy people, this position is easy to maintain. But in individuals with advanced liver disease, something unusual can happen. Instead of holding steady, the hands may begin to flap involuntarily, moving up and down in a jerky, uncontrolled way. This movement is known as asterixis, often described as a flapping tremor. Asterixis is more than just a muscle issue. It reveals a critical connection between the liver and the brain. To understand why this happens, we need to talk about how the liver normally protects the body. The liver's job isn't only to process alcohol or medications, it also clears toxic byproducts created every day through normal metabolism. One of these substances is ammonia, which is produced when proteins are broken down. In a healthy person, the liver quickly converts ammonia into harmless compounds and removes it from the body. But when the liver is damaged, this detoxification process fails. Ammonia begins to accumulate in the bloodstream and eventually crosses into the brain. When ammonia interferes with brain function, the result is hepatic encephalopathy. The brain briefly loses its ability to maintain steady muscle control, then tries to correct itself, causing the characteristic flapping motion of the hands. However, hepatic encephalopathy can be far more serious than just a tremor. It can progress to confusion, disorientation, extreme sleepiness, and even coma. I vividly remember evaluating a patient in the emergency department who had been found unresponsive by a friend. His vital signs were stable, his blood sugar was normal, and there were no obvious signs of trauma. I performed a strong sternal rub, a painful stimulus used to assess consciousness, but there was still no response. During the exam, something else stood out immediately. There was a distinct, musty sweet odor on his breath that I recognized instantly. This smell is known as fetor hepaticus, which literally means the foul odor of the liver. It's caused by toxins such as dimethyl sulfide that build up in the bloodstream when the liver fails. These substances are then exhaled through the lungs along with carbon dioxide. Urgent blood tests revealed extremely elevated ammonia levels. As it turned out, the patient hadn't had a bowel movement in 3 days. So yes, severe constipation played a role. Bacteria in the intestines break down protein and produce ammonia as a byproduct. Without regular bowel movements, ammonia-producing bacteria multiply. And because this patient's liver couldn't clear the ammonia, it built up and effectively poisoned his brain. The encouraging part is that hepatic encephalopathy is often reversible. And interestingly, the treatment focuses on the gut. We use a medication called lactulose, a special type of laxative. It helps move stool through the intestines and also converts ammonia into ammonium, which is far less likely to be absorbed into the bloodstream. It's remarkable to watch someone regain clarity or even wake up from an unresponsive state after treatment begins. This condition highlights just how closely the liver, gut, and brain are connected. Signs number 12, jaundice. Now, take another look at the video showing asterixis. Do you notice how the woman's skin has a yellowish tint? This discoloration is called jaundice. It occurs when the liver can no longer properly process bilirubin, a yellow pigment produced when red blood cells break down. Under normal conditions, bilirubin is filtered by the liver and eliminated from the body. But when liver function declines, bilirubin builds up in the bloodstream and begins to deposit in the skin and eyes. As levels rise, the yellow color can become quite pronounced. In some cases, it even changes the color of urine, turning it a dark yellow or tea-brown shade. While jaundice is a common cause of dark urine, it isn't the only one. I've actually made an entire video explaining what urine color can reveal about your health, which I'll link in the description if you'd like to explore that next. Jaundice is one of the most recognizable signs of liver disease, and when it appears alongside neurological symptoms like confusion or tremors, it often signals advanced liver dysfunction that requires urgent medical attention. And beyond jaundice, liver disease can also affect how easily you bruise or bleed, another important warning sign we'll look at next. Signs number 13, easy bruising and bleeding. Another important and often overlooked warning sign of liver disease is unusual bruising. Most of us have noticed a bruise at some point and wondered how it got there. That can be perfectly normal. But when bruises start appearing frequently, seem larger than expected, or take an unusually long time to fade, it may signal a deeper problem, particularly with liver function. To understand why this happens, it helps to know how the body normally stops bleeding. When a blood vessel is damaged, your body forms a clot to seal it off. This process requires two key components, clotting factors and platelets. Clotting factors are specialized proteins that allow blood to coagulate properly. These proteins are produced almost entirely by the liver. When liver disease develops, the liver's ability to make these clotting factors declines. As a result, blood does not clot as efficiently, making even minor bumps or injuries more likely to cause visible bruising. Platelets play a different but equally important role. They are tiny blood cells that rush to the site of injury and clump together to form an initial plug. Platelets themselves are produced in the bone marrow, but the liver still plays a critical supporting role. The liver produces a hormone called thrombopoietin, which signals the bone marrow to make platelets. In liver disease, levels of thrombopoietin drop. This leads to reduced platelet production, further impairing the body's ability to stop bleeding. To make matters worse, the spleen often becomes enlarged in advanced liver disease. An enlarged spleen can trap and hold onto platelets, removing them from circulation and lowering platelet counts even further. The combined effect, fewer clotting factors, fewer platelets, and platelet sequestration, creates a perfect setup for easy bruising and prolonged bleeding. Prevention, protecting your liver before damage, occurs. Unfortunately, once liver disease reaches an advanced stage, there is no true cure other than a liver transplant. That's why prevention is absolutely critical. This topic deserves an entire video on its own, but here's the big picture in simple terms. One of the most preventable causes of liver disease is alcohol-related damage. Limiting alcohol intake, or avoiding it altogether, can dramatically reduce liver stress and long-term harm. Another major contributor is metabolic syndrome, which is closely linked to obesity, insulin resistance, and type 2 diabetes. This has become the most common cause of liver disease I see in the hospital today. The most effective prevention strategy here is maintaining a healthy weight, managing blood sugar, and staying physically active. Chronic viral hepatitis is another important cause. This includes hepatitis B and hepatitis C. There is a highly effective vaccine for hepatitis B, and I strongly recommend it for anyone who has not been vaccinated. As for hepatitis C, a true cure was developed about a decade ago, completely transforming outcomes for millions of people. Because of these advances, hepatitis C is likely to become a far less common cause of liver disease in the future. If you enjoy learning how your body can reveal signs of disease before serious symptoms appear, I encourage you to watch the next video, where we explore what your hands can tell you about your overall health. Until then, stay curious, take care of your body, and prioritize prevention. I'll see you in the next video.